Now coming to the movements, anatomical movements, these are also very important. You are going to repeatedly hear them, so you must clear this topic right now, right away. Okay. Flexion. Flexion. These movements will be at any joint. Okay, like this. Let's take a standard joint, that is a joint of elbow. This will be a humerus and the radius bone. Okay, we are seeing it from the lateral side. You have to be a clear 3D imagination for anatomy. So you have to imagine every time. So let's imagine that we are seeing this body from the lateral side. So coming to flexion, when we decrease the angle of any joint, I repeat, when we decrease the angle of any joint, it is flexion. When we bring that proximal part of the body close to the distal part of the joint of the body, then it will be flexion. For example, when we bring the hands, the lower hands close like this, when we move this in this manner, it is a flexion. Another example, when we move our knees, our lower leg near the femur, the upper leg, decreasing the angle between the joint, it will be flexion, right? The opposite is extension, when we not decrease but we increase. Okay, when we make this hand get back to the original position, when we make this angle greater, this angle, let me change the color. So extension is when we make this angle greater, then it will be extension. For example, when we bring this hand back again straight, at anatomical position, right? So it will be extension. So flexion and extension are opposite to each other. Flexion is when the angle is decreased, like the movement is in this manner. When the angle is increased, the movement is in this manner, it is extension. Abduction, adduction. Okay, coming back to the anatomical position like this. Yes, let me rub it. So this was the standard position where the hand is kept. It is not anatomical position, but we can say it is a natural position of the body. When this hand is made to go away from the body, it is abduction. I repeat, when we make this hand move away from the body, it will be abduction. And opposite, when we make this hand come close to our body, it will be adduction in this manner. Okay, we are standing and making this hand go away laterally, it will be abduction. When we will bring back medially, the movement will be medial, it will be adduction. Same for the leg. Yes, you can see this image right here. When we move the lower leg away from the body, it will be adduction, and when we make it back towards the body, it will be abduction. It will be adduction, sorry. Ab, B. The B comes prior to D, right? So to do the adduction, we must do the abduction first. Remember this. This is how you can remember it. So to bring that hand back towards your body, you must make that hand go away from your body, right? So to make that hand go away from your body, you have to do it first. So B comes first. Okay. Now medial rotation and lateral rotation. Rotation, you can understand what is rotation. So when we rotate any joint, So there are few joints that are rotatable. There are not all the joints are rotatable, but there are few. For example, the hip, the humerus, right? So taking the example of humerus, let me explain. Right, this, when the hand is like this, okay, we are keeping the hand like this, and when we rotate and make the hands go away from the body laterally, it will be a rotation, because here this complete humerus is fixed. But when, imagine this, you must do the imagination, right? So when you imagine, you will understand that humerus is fixed, but it is attached here and here. Let me change the color. Yes, it is attached here and it is attached here. So when you move the lower proximal hand away laterally, the humerus will not move but will rotate circular. Okay, so, and it will be rotating laterally, so it will be a lateral rotation. And opposite of lateral rotation will be medial rotation. When you will bring that laterally rotated hand back towards your medial body, the humerus will rotate medially, so it will be a medial rotation. Okay, lateral rotation, medial rotation, I think they are being cleared. If not, repeat the video and understand it. You can make the video placed slow, you can make it on 0.75 or 0.5x and understand, repeat it again and again. Okay, then come here. Okay, now supine position, supination and pronation. These are opposite to each other. Remember supine? Yes, so that word is coming here, supine. Supine nation, to do anything. Supine. Pronation, to pronate anything. To supinate anything, to pronate anything. So yes, this image explains the best example of supination and pronation. Take the example of hand in this anatomical position, like this, when it is facing forward. Keep your hand in supine position. Remember the supine position when the palms are facing upward, right? So like this is the supine position. So when you make your hand rotate and make the supine position of your palm at pronate position, you do the pronation. I repeat, when your hand, we are taking the example of the lower hand, the lower limb of the upper hand, the proximal hand of the upper hand, a limb. So this supine position, when it is rotated and the palms get in the prone position, we do the pronation. And the opposite will be when the hand is at the prone situation state, and you rotate it to make it at supine position, you do the what? Supination. Okay, let me drop it. It is getting very messy. Yes. So, supination, pronation. The lower proximal hand of upper limb is the classic example of supination and pronation. Okay, now circumduction. Circumduction is when all these movements, not these, but these movements are done together. Doing all these movements together is circumduction, or simpler, when you do this, like you rotate your hand like a like in a circular manner, it will be a circumduction. When you rotate your lower limb in a circular manner like this, it will be a circumduction. C for circle, C for circumduction. It is very simple, and when you do this, you will notice that all these movements are being followed. You will do the flexion, extension, abduction, adduction, all in circumduction. Okay, and one more movement or pair of movements there, that is protraction and retraction. So this image, the joint of the mandible and the maxillomandibular joint, or this joint here near the ear, anterior to the ear. Okay. When we make the mandible, this mandible, when we make this mandible move forward, like you do, move the mandible forward. Yes, what you are doing, you are protracting, and opposite of it, bring that mandible back towards the body, right? You are retracting. So this joint, when you are making this joint, this bone away from the body, this protraction, and we are making this joint, this bone towards your body, you're retracting that joint, that is retraction. Okay, I think it is clear. If it is not, just repeat the video. We have learned the anatomical movements, right? The anatomical relations. Yes, anterior, posterior, superior, inferior, remember? And the movements, flexion, extension, retraction, all these things. The anatomical position, not M. Okay, so it was a very general topic. You will study it in your general anatomy, any book. You must know all these things. You are going to repeatedly go through these things. Okay, so thank you very much for staying till now. It was a lengthy video, but it ended, and I have explained it. I have given my best. So please like. And my name is Mohammed Saad, signing off.